Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll cover the basics of cold and superficial heat. We'll discuss when to use each modality, how they affect the body, common applications, and the precautions and contraindications you need to know for safe and effective treatment. Superficial heat and cold are passive treatment modalities commonly used in rehabilitation. Their primary purpose is symptom management rather than treating the underlying pathology. They can help reduce pain, improve comfort, and prepare a patient for movement, but they should almost always be combined with interventions such as exercise, manual therapy, and patient education. Choosing between heat and cold depends on your treatment goals and the patient's presentation. Cold causes blood vessels to constrict, reducing blood flow to the area. As blood flow decreases, tissue metabolism slows, reducing the inflammatory response and helping decrease pain. This is one of the primary reasons cryotherapy is commonly used following acute injury or surgery to help control pain and swelling before beginning therapeutic exercise. Cold is commonly used for three primary reasons. First, it helps reduce pain. During treatment, patients typically experience four progressive sensations remembered by the acronym CBAN: cold, burning, aching, and finally numbness. Second, cold helps manage acute swelling through vasoconstriction, which is most effective during approximately the first 15 minutes. If cold is applied for longer than about 20 minutes, a cold-induced vasodilation response, known as the Hunting response, may occur. Finally, cold also produces neuromuscular effects. Very brief applications can facilitate a muscle contraction, while longer applications slow nerve conduction and help decrease muscle guarding, muscle spasm, and spasticity. Okay, let's discuss cold application. There are several common methods of applying cold. An ice bag is one of the most effective because the melting ice absorbs a large amount of heat through a phase change and can be applied directly to the skin. Commercial cold packs are convenient, but require a protective barrier to reduce the risk of skin injury, although placing them over a damp towel can improve heat transfer. Ice massage provides rapid cooling over a small treatment area and is applied using continuous circular or longitudinal strokes until the skin becomes numb, usually within 5 to 10 minutes. It is important to distinguish between precautions and contraindications. Precautions require increased monitoring, while contraindications mean it should not be used. Cold should be used cautiously in patients who may not accurately communicate discomfort or who have difficulty understanding instructions. Extra care should also be taken when treating superficial peripheral nerves, patients with hypertension, and those with a history of frostbite. Cold is contraindicated in patients with peripheral vascular disorders, such as cryoglobulinemia, paroxysmal cold hemoglobinuria, Raynaud's disease, or peripheral arterial disease. Cold is also contraindicated in individuals with cold hypersensitivity, impaired sensation, regenerating peripheral nerves, burns, wounds, skin rashes, or impaired temperature regulation, as tissue damage may occur without the patient's awareness. We also want to know what is a normal response and what is abnormal or adverse. During a normal treatment, patients should experience the CBAN sequence: cold, burning, aching, and finally numbness. These sensations are expected. However, treatment should be stopped immediately if the patient experiences severe pain, excessive skin discoloration, itching, hives, or blister formation, as these may indicate an adverse reaction. Now let's discuss superficial heat. Overall, heat causes vasodilation, increasing blood flow to the treated tissues. The increased circulation raises tissue metabolism, improves oxygen and nutrient delivery, and increases collagen extensibility, allowing muscles and connective tissues to stretch more effectively. Heat also helps reduce muscle guarding while increasing the patient's pain threshold, making movement more comfortable. Superficial heat is generally used for subacute and chronic conditions, rather than acute injuries. It helps reduce pain, relax muscles, decrease joint stiffness, improve range of motion, increase tissue extensibility, and promote tissue healing. Heat is often applied before stretching or exercise to improve tissue mobility and patient comfort. Remember, precautions require increased monitoring, while contraindications mean heat should not be used. Heat should be used cautiously in patients with impaired circulation, poor thermal regulation, cardiac disease, demyelinated nerves, pregnancy over the low back or abdomen, or over metal implants and skin conditions. Heat should be avoided over acute inflammation, active bleeding, thrombophlebitis, malignancy, severe peripheral vascular disease, impaired sensation, impaired cognition, or over the eyes. Unlike ultrasound, superficial heat is less controlled, making impaired sensation a stronger contraindication. Next, let's look at what constitutes a normal response to superficial heat and what is abnormal or adverse. During treatment, patients should report a comfortable, gentle warmth. Mild sweating is normal, and skin color may or may not visibly change. Treatment should be stopped if the patient reports burning or itching, or if blisters, swelling, rash, bruising, dizziness, or fainting occur. Several methods can deliver superficial heat. Hot packs provide moist heat by conduction and are commonly used over large muscle groups. They require 6 to 8 layers of towels to reduce the risk of burns. Paraffin is ideal for the hands and other small joints affected by stiffness. Flutotherapy uses dry heated particles suspended by moving air, allowing treatment while the patient performs active movement. Infrared delivers heat via radiation rather than direct contact. Although each modality transfers heat differently, they all aim to increase tissue temperature to reduce pain and improve mobility, with most treatments lasting about 15 to 20 minutes. To wrap up, remember that cold is generally used for acute conditions to reduce pain and help control inflammation, while superficial heat is best suited for subacute and chronic conditions to reduce stiffness and improve tissue extensibility. Before every treatment, screen for precautions and contraindications, and continue monitoring for adverse effects during and after the intervention. Finally, choose the modality based on your treatment goals, and remember that thermal agents are most effective when combined with exercise, manual therapy, and patient education.
That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.